So, welcome, Sam, to our podcast. It's such a pleasure to have you here and see your face. We already know each other very well, so it's really great to see you today.
Yeah, it's really nice to do this. It's a little nerve-wracking anytime you're invited to do something like this, but I'm like, I know Tammy. I'll be comfy.
Yeah, we'll be good. And just so everyone knows, Sam and I have had a professional relationship throughout actually her internship with me, and then
Mm.
just we both work for the same university part time, and just clinical practice. I don't know how many years it's been. It's been a
Wow,
few.
a few, lots of crossover.
Yes, lots of crossover. So we're here today talking about sex and consent, and it's a hot topic. And I know we were just talking before we hit record that
Mhm.
I've got three kids at home, and this is coming up with all three of them at different developmental levels. So I've got
Yeah.
a 7-year-old, an almost 10-year-old, and then a teenager who's in the midst of romantic relationships that we have to navigate that. So it
Right.
should be interesting to have this talk. um yeah, so I'm going to dive in with the first question and we'll
Bring
just
it.
kind of roll with it from there. um when we think about, I want to first kind of debunk this myth for all of you parents there, that, and Sam can speak to this, that we need to talk to our kids about sex because not talking about it is worse, because there's this
Yes.
myth, if we don't talk about it, then we're not encouraging it. But what
Yes.
what can you say to that?
Oh, I'm so glad that this is how you wanted to start our conversation because as soon as I get the request to talk about this, I'm always like, okay, because I know this is something that makes parents and caregivers so uncomfortable. I recognize that because we've really internalized this messaging that us even having these conversations is destroying the innocence of our children.
Yeah.
And then when we actually look at the research, though, there's all this counter evidence saying us having these conversations, us offering some information and some knowledge actually empowers our kids to make healthier decisions in the long run. We see that if we introduce some of these concepts and we let kids talk to us about this stuff, they're actually more likely to delay having sex for the first time. They're more likely to have less partners. They're more likely to use protection. Like they make healthier decisions versus us trying to avoid this topic and kind of just sending them out to the world with a blindfold on.
Yeah. And let's be honest, the information they're getting from the internet and from
Yes.
their friends is not the information we probably want them to be getting, right?
No.
Like we have to think about the skewed messages that exist on the internet, pornography. And you might think my kid's never going to watch pornography, but actually most children will get exposed to pornography by the time they're 16. So is that the message we want them to have about sex, about objectification of women and rape and all of these different messages that can exist? Like, is that what we want them?
Absolutely.
No.
Absolutely. Like we've come up with all of these security systems to try and keep our kids offline and keep them from seeing different things and all these firewall things that we can install. But first, kids are smart. Like they can figure things out. They know how to work around things. And two, even if we have all of the secure systems in our home, that's not to say they're not going to go to their friend's house one night and see something. So they are
Absolutely.
going to be exposed to things, and it's so much safer for us to set the basis of being like, hey, this is some of the stuff that actually exists out there, and I want you to know that I'm going to be open to talking to you about it. You won't be in trouble for asking questions, so at least I can make sure you have accurate information.
Yeah. I remember studying about these abstinence only programs that exist. And for we're in Canada here, we're a little more progressive maybe than some places in the US. We have a lot of people in the US who watch this or listen to this. And I know there is a level of sometimes religion that goes into this, and maybe we don't agree with our kids having sex before marriage. But I just want to just highlight that again, that by teaching children abstinence only without an education about what sex is and what can happen and what are the risks and what it really is, we increase the chance of our kids having premarital sex actually, if
We
we don't
do.
have these conversations. So it's so important that I think especially comes from, maybe you don't want it to come from the school, fine, but then you need to be having the conversations at home.
Mhm.
Like that is the bottom line here. Maybe you don't think there's a place for it in school, but there needs to be a place for it in our homes.
Yeah, I completely agree with you. And I wish I had looked up this study up before. I can't remember who did it. So maybe we don't quote me on this, but I know there's a study that was done that said there was an abstinence only program run taught to kids for their sex ed curriculum. And within 20, or not within 26, within a year, 26% of those teenagers had gotten pregnant because there was no understanding of how to prevent pregnancy or what safe sex even means because all they were taught was abstinence.
Yeah.
And that can be a value in someone's family. I'm not going to tell families that they're not allowed to educate kids on what abstinence means or that we want to save sex until marriage. Like, if that's the value in your family, that's okay. But we still need to be providing education
Yeah.
around what other things are. You can
Absolutely.
teach your values, but we also need to make sure that a holistic picture is given because kids are going to be presented with other information. And they need to know how to think critically about it and how to apply their own values versus feeling forced into situations or not really understanding the context of what's going on around them.
Okay. Perfect. And now let's start with, now I know most of you are thinking this is going to be about teenagers, but let me tell you, this has been a conversation I recently had with a 7-year-old in my household.
Yeah.
Okay? Because kids are going to ask the cliche question, where do babies come from? Like they
Mhm.
ask.
Yeah.
And
It can come around at like 4 or 5 years old.
absolutely. And my son has shown a very big interest in this topic, which is absolutely developmentally appropriate.
Yeah.
I remember walking out of his room and being like, to my husband, being like, yeah, we just had to have, we, at 7, we had a sex talk about like where the penis goes and what a vagina is. And this is how people get pregnant. And I'm like, that happened a little sooner than I thought it would, but here we
Mhm.
are.
Here we are. Here we are. And at least now he has some accurate understanding versus like the magical thinking that kids will come up with on where babies come from.
Absolutely, which is
Yeah.
terrifying. All right.
Terrifying.
So if we're going to, maybe I'll why don't you say how you would speak to an elementary age? So any of you who are in kiddos, we're talking grade school, like 5, all the way up to like your 10, like we're not talking teens yet, right? So the chances are they're not having sex, but they want to understand like where pregnancy happens and what sex is, and maybe they've heard the word sex. Like how would we approach it at the younger age? It might be 4 and 5. So like
Hmm.
maybe we can kind of break it down how we would start there, and we can go a little older from there. Because I
Yeah,
mean, by
for
the time
sure.
they're teenagers, they know what sex is. So then we have to start talking about a few other things.
May I freak out our listeners a little bit more?
Yeah.
Can I go back just a little bit earlier too? I wouldn't start talking about sex earlier, but I think really setting the foundation for these conversations is teaching our little ones, like the 2 to 3 year olds, basic body anatomy. I think
Yes.
it is so unbelievably important that we start with that and that kids have accurate vocabulary to describe their bodies. My background, actually, before I even got into the mental health field, was working in child protection. And obviously, because of this, I've seen some horribly sad stories. But I can't tell you how many little ones have come in to talk to us about things going on in their lives, but they don't know how to label what actually happened because they don't know how to describe their bodies.
Mm.
And so I think it is just so important that we start with that, with the little ones. Just teach them what a vulva, what a vagina, what a penis is. Let's talk about that. Let's use those words. And I know as I'm saying this, there's always the reactions of like, ah, like I don't want to. And it feels weird. It totally does. And that's okay. It's okay for us to feel a little bit weird, but think about how empowering it is for the kids to be able to talk about their bodies and what that actually is versus
Well,
trying to make up words for it.
and where there's no shame attached to it,
Yeah.
right?
Yeah.
uh and then like you said, the communication is just there, and we've set also boundaries around that. And then if their if their boundaries are violated, that they have those words again to explain to you or another adult
Mhm.
if someone does touch them inappropriately, if something horrific does happen, they know how to describe that very,
Totally.
yeah, very
Totally.
literally.
From the horrific side, but also even for like the innocuous side, even just like, I'm feeling kind of itchy down there. Let's give them the vocabulary to be able to say that so they know how to ask for help if their bodies aren't feeling right. Like I have a 3-year-old daughter now, and I have taught her vulva and vagina and these kind of words. And yes, there are moments. There are those little moments where you're like, oh, I kind of wish I didn't because she says the word vagina at the dinner table when an aunt is over. And like, yes, it's going to make the other adults in the room go, oh my gosh. But I'd so much rather have that little moment of awkward family tension versus her not feeling empowered to tell me if something's wrong or if she feels weird in a situation.
Beautiful. And thank you for backing us up because we forget that it does start when they're really, really little.
Yeah.
And with my son, I mean, we've been calling it those things forever. So there's no weirdness in our house about calling things anatomically. Like
No,
that's
us either.
that's it.
It's very normal. It just the normalness makes it so normal to the kids that yeah, sometimes they're going to say it in situations where you're like, okay, maybe not here, but yeah.
Yeah. Okay, Sam, I'm just gonna so our editor, I have to pause. I have to plug in my computer. Just
Oh,
give me
that's
one
fine.
second here. Okay.
Yeah.
All right. So we'll start. Okay. So now we get our kiddos to say elementary age,
Yeah,
it could be kindergarten, 5, let's say
totally.
they're, 5 and up. And they may ask the question, where do babies come from? Or what is sex?
Mm-hmm.
How would you handle that?
Um, this is where, and I can appreciate from a parent caregiver's perspective, you're going to hear me saying this and going like, I don't want to. But hear me out before you totally write it off. Um, I would give an honest answer. In regards to how comprehensive we are, I think we also want to give ourselves a little bit of a judgment call here. You know your child best and how much material they're going to be able to comprehend. So what I say right now might work for some kiddos, and for some kiddos that would be like way over their head. And so you're going to have to give little bite-sized chunks. But overall, I would give a full comprehensive answer. I would say something like, so sex is an activity that happens between two adults. When we're going into an act of sex, between hold on, let me think about how I want to phrase this because I'm always wanting to be like inclusive in my language, but with the little ones, there's going to be more of a distinctive understanding, a binary understanding. And I say that because the topic of gender is going to come up when we start talking with our higher level school or teenage kids. But with the little ones, it's still more of a binary understanding. They're still working on that concept. So when a man and a woman get together for a sexual act, what typically happens is that a penis is inserted into a vagina. And again, I'm hoping by this point they have some understanding of anatomy. If we don't have that yet, we've got to go back and do that basic foundation labeling the body parts. But a penis is inserted into a vagina and it releases something called sperm. Sperm are little cells that contain half of the information that we need to make a baby. In the woman's body, she has what's called eggs. Eggs contain half of the information that are needed to make a baby. So when the sperm and the egg meet, all that information comes together and we can start to grow a baby. Now, baby will grow inside the woman's tummy. She has an organ in there that's called a uterus. And a uterus is like a cozy little den where the baby can grow. So over the next 9 months, baby grows inside of that uterus. And the uterus gets bigger and bigger and bigger as baby grows. And then when baby is big enough, baby is born outside of the vagina, or sometimes doctors make a cut in the mummy's tummy so that baby can come out that way. Sometimes babies are raised with the families that created them in the tummy, and sometimes babies go to live with other parents who love them very, very much. And that's probably the extent of what I would give. I appreciate that there's a lot more to sex and to different sexual acts and how different partnerships might develop or what they look like. But that's probably enough for a 4 to 6 year old to understand at this point. That gives the basic premise of sex and procreation.
Yeah. I gave my son a very, very similar breakdown to that. And his response was, ew, okay, mom,
Yeah,
that's enough.
yeah,
But that's
that's,
and he is a question which is interesting for parents who aren't married, and I am married, but my son is a blended family, so my son was created with someone who is not my current husband. So
right.
then of course the question came, which it will, just by the way, if you come from a blended family, well, don't you have to be married to have a baby?
Mm-hmm.
And I realize religious religion may come into play here, but I think it's very important for kids to understand as young as possible that you can still make a baby and not be married, but maybe you say maybe your morality says you should. That's fine, but make sure they understand that a baby can be made even if you aren't married. Because that my son really struggled with that, and he was trying to figure this out. So I had to be very clear that it's a boy and a girl, and no, they're not married. Like
Mhm.
a boy and a girl can make a baby. Very
Mhm.
clear.
Exactly. Exactly. Um, and so I think there is great value in whenever we're talking about sex and procreation and what that means to also discuss the fact that there are different types of relationships too. Like people grow up in different types of families. They don't all look the same. Parents don't all look the same, but this is the basis for how babies get made.
Yeah, we're talking the literal science of how this works. And of
Exactly.
course, if if you did in vitro, or I've
Mhm.
realized that we're trying to tell our kids that this is how it is. We're kind of the starting point. This is the basis of the
Yeah.
first talk, and then we can go from there.
Exactly. And I would say too, like if we're in a family where in vitro happened, we can also talk about that. We can talk about that. We're just not going to label the in vitro process as sex.
Right.
So we can
Exactly.
say like this is how babies are made through sex. For you, my special little nugget, we had the sperm cell and the egg cell meet outside of the body. It was so cool. So people were able to look at these cells forming before they were even in the tummy. Isn't that cool? So we can still talk about it. But again, if we're discussing sex, that is the physical premise of what was happening.
Okay. Absolutely. Um, my son asked why. So, do adults have sex if they don't want to have a baby? Because again,
Good
my
question.
good question. My husband and I are not having any more babies, and none of our kids came from the two of us.
Mhm,
So, the next question, which makes parents, I think, squirm even more, and you tell me if you would add to this. I told him mom and dads, or women and men, or because,
mhm.
and then it comes down to the other people. People can have sex, and it cannot be about it can be two vaginas, and it can be two,
Yes.
that people have sex because it feels good. It's
Yes.
sometimes to make a baby, and sometimes because it feels good. But adults do this when they care about each other, and this is obviously, this is a young child. Like, we're not going to talk about rape, we're not going to talk about non-consensual sex. We're talking quite literally at this point about to normalize that it is something adults do because it feels good, but it's
Yeah.
also they are in a relationship and they care about each other. That's it in my home how we personally discussed it.
No, I think that's so appropriate. And again, I am so glad that you brought up the fact that this makes people really uncomfortable. We don't want to feel like we're going out telling our kids that, hey, you should be having sex. It feels great. Um, and when we get to the teenagers, I kind of laugh at that a little bit because having the talk with their parents does not make a kid feel sexual at all. I can promise you, it's a turnoff.
No.
But even with the little ones, I think it's important that we do kind of frame it that way that yes, adults sometimes have sex even if they don't want to have a baby because it's one way that they celebrate that they love each other. It's one way that they feel connected to each other and it helps them feel good about their relationship with each other. But this is something that adults do in their relationships.
Yeah, when you're an adult, and we did talk about that, which then led to, well, how old's an oh my goodness. So like,
Yeah.
I feel like my kiddo asks a lot of questions, so some of these we're gonna have to revisit as he grows several times. But he was good with that, of being like that. He understood that's a long ways away for him.
Yes.
So, but Nan, I guess when we talk about as kids age, this obviously changes because it's not that far off, or it has happened, and or it might be happening soon. And I have had the luxury privilege of having
Yeah.
this talk with a teenager already,
Yeah.
um, which was uncomfortable, and she hated every second of it. Let me tell you, it was
Totally.
not fun for her. So
Probably not.
no, so I mean, as we get towards those tween or teen years, how does that conversation shift?
I think as we get to the older ages, then we want to start giving a little more detail. Because what I gave you as my explanation for like the preschoolers, very early school age, it's simplistic. It is just the basic biology of what sex is. But as we start getting into our older kiddos, our tweens, our teens, that's when If we're talking about sex, I would also be making it more of a comprehensive conversation about relationships as well, because I want my kids to understand that, yes, sex is an aspect of relationships, and this is going to be something that you're going to learn how to navigate. But I want to make sure that you never feel pressured into it, that you understand what are green flags in a relationship. How do you know that you're feeling safe? How do you know that your boundaries are respected? How do you know if you're feeling ready to take a step to become more intimate with someone? I want those conversations had too, in addition to just sex. Because I think we've been taught a lot and we see it online all the time. How do we watch for the red flags? But I think it's equally as important to teach our kids what are green flags. Like, how do we know when something is healthy and good too? So, that I would start with. But then when we're talking about sex as a whole, then that's when we can get a little bit more comprehensive in what sex can mean. So, we can explain to them that sex is more than just penis in vagina. There's other things that might go along with it. There are other things that people can do to feel intimate with their partners. This is when I'd also want to start introducing the ideas of contraception, or how do we not have a baby if this is something that we're engaging with. I'd want to talk about STIs and the fact that they do exist anytime sexual activity can occur, but you're also not going to get an STI from sitting on a toilet seat in a public bathroom. So I'd want to be giving accurate information about these kind of things. And big asterisk on this one, this is a really important part, letting these tweens and teens know where they can get more information if they have questions. They might not want to come to us as parent or caregiver to answer everything, but is there a safe website where they can look up their questions? Or is there a way they can talk to a doctor and ask things about their body so that they know how to get accurate information? And again, we're not just Googling online to figure out what does a hand job mean, because you're going to get a lot of information that you might not want to see.
Yeah. Yeah,
Yeah.
I think that part of it is parents being very informed on what the lingo that's being used for, especially for teens, what that
Mhm.
is. So we're using the correct language, which they might be mortified by. I know
Mhm.
with my daughter, she's bisexual and she's in relationship with another girl. So
Mhm.
immediately when we started talking pregnant, she's like, I'm not going to get pregnant. Can we not talk about this? And I was like,
Right.
I understand you're really uncomfortable right now, but we do need to talk about STIs. And
Yes.
we actually Googled them together and we looked at some pictures and we looked at symptoms and like these are the kinds of things. And we talked about whether they're monogamous or not, or they're
Mhm.
in more open relationship, because
Mhm.
you never know with our kiddos. And it turns
Right.
out there is an aspect of there that my kiddo might need to be aware of something. So that was we were able to bridge that and say, okay, well, this is the reality of your relationship. So we do need to talk about this.
Yes. Yes, absolutely. And again, I think just offering that comprehensive information is so valuable. They might not need all of it right away. They might not. And honestly, they might not remember everything that we cover with them. But one, we're setting the stage to let them know you can talk to me about this. It's safe. I will answer your questions. And two, that foundation of knowledge is there. So that when they start navigating these relationships, they can be like, oh, yeah, I remember when my mom said something about this. Like, I remember that these are some of the options that exist, type thing. Versus, again, I don't ever want these kids to feel coerced or forced into a decision that doesn't really feel like it's a fit for them.
Okay. Now, what would you say about now we can talk to our kids. Hopefully we've set the stage for they understand what
Mhm.
sex is. We might have to talk to them, which actually I did, what oral sex is and what
Mhm.
other things that, might be going on. We won't get into all the details here, but with a teenager, yeah, we're talking about what those things are and what they
Yeah.
mean. And I also told my teen that when you do have sex, because at this point we've delineated what sex means for her with another girl. Like that's
Mhm.
important to know. I have a teen that swings both ways here. So we had to talk
Mhm.
about both. These endorphins that are released in her brain, that of course it feels really good. We get a lot of dopamine
Mhm.
and it can make us feel an oxytocin, which makes us feel very close to someone.
Yes.
And our brain can make mistakes. We can have, if we have sex with someone and we aren't that close, it can make us feel closer than we are.
Yes.
So that is an element that we have discussed. So
Good.
we,
And I think that's so important. And that's why, like, I really harp on that idea too in the beginning. Whenever we're talking about sex with our older kiddos or our teens, we're also talking about relationships. What is healthy? How do I know if I'm safe? How do I know what feels good? How do I express my boundaries? What happens if I put myself out there and they say no to me and I feel rejected? How do I handle those feelings? Like all of that has to go with the conversation of sex.
Yeah. And I think too about it's an intimate act. And
Mhm.
we, like with my teenager, we have had to have discussions about even you're intimate with someone and this is your partner. We're not sending images of our
Yeah.
bodies through the internet, through Snapchat, through and I think that let's back up to what you said earlier with our littles. So
Mhm.
when we talk to our littles about penises and vaginas and vulvas and testicles, one
Mhm.
of the parts that I've brought in, and maybe you can speak more to this, is I talk to my kids that we don't let people take pictures of those parts of our
Yeah.
body, and only certain people see those parts of our bodies.
Yes.
Obviously, when they're little, like it's different than when you have a teenager, right? But there's
Mhm.
still, we're talking about boundaries, and it evolves into the idea of consent as they become much older. But young
Mhm.
children can't consent. So we have to take that out of the equation. Young children don't consent. Let's be very clear.
Yes.
It's about boundaries that we're teaching them about their bodies.
Yes. I'm so glad that this conversation came up too, because I think it's so important. Because I hear, thinking about how I want to phrase this, I have been turned away from talking in specific areas about sexual health education because people get really concerned about teaching kids this topic of consent so early. They get very concerned about that. In the sense that, again, we don't want to be giving the impression that we're pushing our kids out there to go enjoy sex and have it very, very early. Like, that's not the point. But I think the topic of consent is something that's applicable to everyday life. It is just boundaries, it's not purely a sexual topic. And so, if we think about consent as just setting boundaries for myself, this is something that we teach early, 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 early. My kids are already practicing consent and they're 3 and 1. And they're practicing consent in the way of, I don't want you to use my crayons right now. So I'm going to move my crayons away because I don't feel like sharing in this moment. And that's okay. We want to learn how to have some autonomy. And the same with our bodies. So we're talking to them little about, this is your body. These are the different parts of your body. These are the people that are safe. If you need to talk about how this body part is hurting you or if it doesn't feel good, these are the people you can talk to. Your doctor is going to see all of your body parts. He or she is there to make sure that they're healthy. And yeah, sometimes it can feel a little bit weird. And if ever you feel uncomfortable after, you're welcome to talk to me or ask questions. But we're giving them that basic sense of bodily autonomy when they're little. Yeah, so we can build off that idea as we start to talk about consent when they're older.
Yeah, because consent's often like a legal term, so that's why I'm always just like we got to be careful about that because young kids can't legally
Yes.
consent. But one of the things that comes up, like when we think about rape or we think about assault, like these kinds of things, or molestation or any kind of
Mhm.
sexual assault, basically, I think it's important that we talk about that. I want to say especially it's more prominent with our girls. Let's just be honest that it's so
Mhm.
important that we talk to them about this, what no means
Mhm.
verbally and what no means non-verbally. Would you say with
Completely.
consent that could we go there a little bit? We're jumping a little bit, but
Yeah. No, that's okay. I'm fine with jumping. I'm with you. Um, but no, I think it's so important. And this is something that I cover in the webinar too, is there are so many ways to say no to something. And so I don't think it's appropriate that we just teach the messaging that no means no. I think it's anything but clear, enthusiastic yes means no. If you are turning away from somebody, if you're shutting down, if you are starting to cry, if you're pushing someone away, if you're starting to shake because you're scared, all of that means no. So unless there is a clear, yes, I'm game, I'm in it, then the answer is no.
that's
And so I
beautiful.
think that's the messaging that we need to be giving instead.
And that goes for our kiddos who are wanting to say yes, like they're someone's
Mhm.
approaching them and they're giving a yes or no, I don't, yes I do, or I don't want to do this. But also when our kids are the ones initiating it and they are
Yes.
wanting to, and how to read your partner's nonverbals. How do you know you want to have sex or you want to do this intimate act? How do you know your partner actually wants to do it?
Yes.
Like that.
And so, yeah, that's a skill I think we should be practicing throughout the lifetime. Again, not just about sex, not just about sex, but about anything, about just learning how to read people. And so when our kids are in an interaction with a friend and all of a sudden their friend's kind of shutting down a little bit, hey, what do you think is happening with Susie right now? What do you think she's feeling? Do you think she liked it that you helped yourself to your crayons right now?
Yeah.
No, maybe not. Maybe we should ask her if that was okay. And so we're teaching that skill really early on. So hopefully by the time they're preteens, teenagers, and they're navigating some of these more intimate relationships, they have that skill on how to read other people.
Yeah, because I mean, we look for those nonverbals, like people
Mhm.
turning, averting their eye contact, moving away, their eyes, going down, like whatever that is, like for obvious reasons, like looking angry or, being identifying sadness or anxiety, like being able to see that. And parents, let me preface that this starts with you acknowledging their feelings. So the first step is not just your child being able to identify the feelings in someone
Mhm.
else. Actually, it involves you identifying their feelings, and we're
Mhm.
developing these mirror neurons. And then the child can look outside of themselves and say, oh, so and so is frustrated too. I might have caused that. There's a cause and effect piece where, like, oh, I came too close or I did this. But it's actually really difficult for children to do that process where they see an emotion on someone else if we haven't mirrored that back to them through that
Yeah.
process of co-regulation and a validation of feeling and naming the feeling and all of those pieces. So it starts very young, like very
It's
young.
very young. And that brings in that whole concept of bodily autonomy again, too. In order for kids to learn that they have the right to say no about what happens to their bodies, we have to be respectful when they say no about their bodies. And so that brings up that whole like tickling debate type thing. But if the kid says no, stop it, then stop. Because
Yeah.
that's when we're modeling the respecting of their boundary setting.
Yeah, an example would be, we don't make children hug other people when they don't want to hug them. Like, what
No.
is that? What is that teaching them? And I realize many of us were raised that way. I
Mhm.
was. That when your aunt or uncle or grandparent or neighbor come over, you give them a hug and a kiss. And I hated kissing people I didn't like. Ugh, like, but we were taught to do that.
Mhm.
And I always tell my kids, you never have to hug and kiss someone you don't
Mhm.
want to.
I agree. We're working on this with my 3-year-old right now, and I find it's interesting to be in this role as a parent, because it's one thing to be like, as a psychologist, I totally understand I'm not gonna force my kid to hug, and yet when you're in the role as a parent, you're like, "Oh, I actually feel a lot of pressure." Like, there's a lot of other voices that are like, "Sam, you can't let your kids be rude." And so it's interesting to sit in it, holding the knowledge that I have about development and boundary setting and bodily autonomy, but also feeling that social stigma. And so I feel for everybody who's out there right now navigating it, trying to kind of shift this cultural stigma around how do we talk about this stuff? How do we set boundaries? How do we give all this autonomy to our children in a society that hasn't always done that? So I give props to all the parents right now. We are absolutely shifting things, but it can be an uncomfortable process.
Absolutely. And the last piece before we kind of wrap this up, Sam, that I really
Mhm,
that keeps coming up. So I'm like, I have to say it, I have to say it, I have to say it. That one of the things when we're thinking about safeguarding our kids from
mhm,
trauma, sexual trauma, and this goes from young until probably your preschool years
yeah,
upwards. And you're gonna have to help me how you would curate this maybe. But one of the things kids need to know that sometimes when other kids or
mhm,
adults or partner can touch, if they do touch their parts, their vagina, their testicles, their penis, their vulva,
mhm.
it can feel yucky and good at the same time. And that
Yeah.
is so confusing for kids working. I know you've worked with kids with sexual trauma, so have I. That it's important for kids to understand that touching those parts does feel good,
Mhm.
um, and that doesn't make it okay for people to touch those parts, even though it feels good.
Yeah.
And that's important because there's so much ambiguity around people feeling aroused when they're being assaulted.
Mhm.
And parents probably didn't, lots of people might not even know that is actually a lot of shame and confusion for kids around this. So that would be
There's
something I
so
would
many
add to
adults.
this.
Yeah.
Yeah.
So many adults that I see who come in with that same feeling. They've been holding it since they were kids going, "I didn't tell anyone because it felt good."
So I
And
must
so
have consented to it. I must have been okay
exactly,
because it felt good.
exactly. I hear that all of the time.
Yeah.
And so I think that, again, we have so many beautiful little full circle moments happening in this conversation.
Yes.
Um, this goes back to that whole concept of teaching that sex is something that's supposed to feel good. And we can talk to our kids about how this is an area that actually can feel really good to touch. And I'm bringing in another topic now. I appreciate you wanted to wrap up, but I'm bringing in another topic because I think it's worth mentioning too. That's why it is actually normal and developmentally appropriate for some kids to explore masturbation as they're growing. They
I think
will.
most kids do. I don't
Most kids do,
Most
exactly.
kids do.
There's some who won't, and I don't want to say they're abnormal because some don't, but most kids do. Um, and it's not something to freak out over. It's not an indication that the child has been abused. It's just something that feels good. And for most little ones, it's really just a self-soothing technique because it
Yeah.
feels good.
Yeah. Yeah, we get
Um,
that release of dopamine when we do it.
exactly, exactly. And so I think that when we're having these conversations around it, we can let kids know like this is an area that sometimes feels really good when it's touched. And it can feel really good when somebody else touches it when we're older too. However, because you're little, because you're a kid, this is not an area that other people should be touching right now. You can't give consent. You are a child. That is an adult act. And so if anybody ever does touch that area, even if it feels good, I want you to talk to me about it because
And you
that's
won't
not
be in
something
trouble.
that's supposed to be
And you
happening.
won't be in
Exactly.
trouble for doing it.
You will
Yeah.
not be in trouble. No.
Beautiful.
But I need
So
to know so that I can keep you safe.
absolutely. So, Sam, just really quickly, your course. So, everybody who is listening, if you're really loving what Sam has to say here in this conversation, and you're like, oh my gosh, I need more of this. You've got a course with ICP. What sort of things are you covering in your course? And then we'll have a
Oh,
link for it in the description.
I mean, I'm biased. I think it's great.
Oh, I think it's great too.
Thank you. It is very, very comprehensive. So I have 3 different modules in the course. The first one is how do we talk about relationships? What are boundaries? What is healthy? What are the different types of abuse? How do we role model behaviors? How do we communicate things? So we talk all about relationships. The second module is how do I talk about sex and procreation and pornography and masturbation? How do I have all of those conversations with my kids based on the age range they're in? So we talk about discussing things with preschoolers, we talk about school age kids, we talk about teenagers, and what are the different highlights that we want to give them. And then the last module is understanding that topic of consent.
Okay.
What does that mean? How do we set boundaries? How do we understand that as kids? And what are the legal understandings and definitions of consent?
Okay.
So again, what are all the rules around it?
Okay, so your course would be good for even parents with young children. It's not just
Yeah.
for parents with teens. Okay, perfect. We
No.
have more parents actually who listen to this podcast who have younger kids. So I
Yeah,
wanted to let them know that this course would be appropriate, like for even for
absolutely.
littles. Okay. And to
Absolutely
prep them.
appropriate. Yes, that's what I'm thinking. It actually would give you the foundation for how do we have these conversations as your kiddo grows.
Yeah.
But I think that's the big highlight that I want to give everyone today, too. If you only take out one takeaway out of this, it's that this conversation, this topic is not a one time thing. This is an ongoing conversation that we have as kids develop, as they learn more, and as they can cognitively understand more.
Yeah, we just come back to it
Yeah,
in different levels and reframes, and we add more to it as they can
exactly.
figure it out. Well, everyone, if you want to take Sam's course, there is a link to it in our bio, and we have a coupon code there for 30% off if you want to take this course. It's phenomenal. So, Sam, it was so nice to see you.
You
Hope
too.
everything's going good with your kiddos, and hopefully we'll be connecting very soon. So, thank you so much for sitting with me today.
You are so welcome. Thank you for having me.